Welcome to the Senior Safety Advice Podcast, where we share simple, practical ways to help older adults stay safer, more independent, and more confident at home. I'm Robin Schiltz, a senior home safety specialist, and today we're talking about how newer medication safety guidance can help to prevent common mistakes at home. For more trusted tips and helpful resources, visit us anytime at seniorsafetyadvice.com. Medication mistakes at home often begin with ordinary moments. A new prescription comes home from the pharmacy, or a hospital changes a dose, or a caregiver fills a pill organizer while answering the phone. Someone cannot remember whether morning pills were taken. Well, none of this means that a person is careless. Medication routines can become complicated very quickly, especially when several doctors, pharmacies, vitamins, and over-the-counter products are involved. Recent safety guidance from the FDA and the Institute for Safe Medication Practices puts more attention on a few simple habits. These are not new laws for your kitchen counter. They're updated recommendations meant to catch mistakes before a medicine reaches the wrong person, at the wrong dose, or at the wrong time. The first habit is to keep one complete medication list. That list should include prescription medicines, over-the-counter products, vitamins, herbs, and supplements. Write down the name, strength, reason for taking it, dose, and time of day. Include allergies and an emergency contact as well. Keep one copy at home, one in a purse or wallet, and a photo on the phone. Give a copy to a trusted family member. Most importantly, update it whenever a medicine is started, stopped, or anything about it is changed. A list that was accurate 6 months ago may not be safe today. The FDA says an updated medication list can reduce errors and harmful drug interactions. It may also help emergency workers make a safer decision when a person cannot speak for themselves. The second habit is to pause after every care transition. A transition might be a hospital stay, an urgent care visit, a new specialist, or even a telehealth appointment that changes a prescription. This is the time to compare the new instructions with what is actually sitting in the home. Do not assume that every computer system has shared every change. Ask the doctor or pharmacist, which medicines should I continue, which should I stop, and which dose has changed. If the answer feels confusing, place every medication container in a bag and take the entire bag to the pharmacy or to your next healthcare appointment. Pharmacists often call this a medication review. It can uncover duplicate medicines, old prescriptions, and products that should no longer be used. Medication reconciliation, which means comparing what a person's actually taking with the current medical instructions, is especially important for older adults, people taking several medicines, and those who use high-risk medications. The third habit begins before you leave the pharmacy. Confirm the person's full name and date of birth. Look at the label. Check the medicine name, strength, directions, and the prescriber. If the pills look different from the last refill, ask why. A change in color or shape may simply mean the pharmacy used a different manufacturer, but it can also signal a mistake. Asking the question is not rude. It's a safety check on your part. Preventing wrong patient errors remains one of ISMP's main safety priorities for community pharmacies. Their guidance also supports stronger use of identification checks and barcode technology during the filling process. Liquid medicine deserves its own extra check. Newer safety guidance continues to stress measuring liquids in milliliters, written as ml. Use the syringe, cup, or measuring device provided by the pharmacy. A kitchen teaspoon is not accurate enough, and the size of spoons often varies. The fourth habit is to create one clear home system. Choose one well-lit place to organize your medicines. Keep the current medicines together, but separate each person's prescriptions. Do not ever mix loose pills in an unlabeled container. Remove discontinued and expired medicines so they can't be taken by accident. A weekly pill organizer can help, but it should be filled when the room is quiet. One person should fill it whenever possible. Work from the current medication list and check each bottle before placing the pills into the organizer. Reminders can also help. A phone alarm, written chart, talking clock, or automatic dispenser may reduce missed doses. But technology should support the routine, not make medical decisions. Excuse me. If a device says a dose was missed, do not automatically take another one without checking the instructions or calling the pharmacist. Some medicines deserve an added layer of caution. Insulin and blood thinners can cause serious harm when the dose is wrong. Methotrexate, when used for conditions other than cancer, is often taken weekly rather than daily. That schedule can be easy to misunderstand. AHRQ identifies insulin and blood thinners as high-risk medications, while preventing accidental daily methotrexate dosing remains an ISMP safety priority. For any high-risk medicine, ask the pharmacist to write the plan in plain language. Ask what to do if a dose is missed, what warning signs to watch out for, and when to call for help. And then keep those instructions beside the medication list. Storage of medications matters too. Most medicines should be kept in a cool, dry place unless the label says otherwise. Definitely avoid leaving them in a hot car. Keep medicines away from children, visitors, and anyone who might confuse one bottle with another. Locking medicines may be necessary in homes where there's dementia, poor judgment, or a risk of accidental use. Clean out expired and unused medicines. The FDA says a drug take-back location or mail-back program is the best choice for most medications. Please don't flush a medication unless the label or FDA instructions specifically say to do so. One common fear is that asking for help will make an older adult look incapable, but actually the opposite is true. A good medication system protects independence. It lowers the chance that a preventable mistake will lead to dizziness, a fall, an emergency room visit, or a loss of confidence. Caregivers sometimes believe they have to remember everything themselves, but you do not. The safest system does not depend on one person's memory. It uses a current list, clear labels, a consistent routine, and another set of eyes when something changes. If you think a medication error has happened, don't guess and don't wait quietly for symptoms to develop. Instead, call the pharmacist, the prescriber, or poison control at 1-800-222-1222. Again, the poison control number is 1-800-222-1222. If the person collapses, has a seizure, has trouble breathing, or cannot be awakened, call 911 immediately. So today, choose one small step. Update the medication list, check the pill organizer, remove an old bottle, or schedule a pharmacist review. Medication safety is not about doing everything perfectly, but it is about building enough simple checks into the day that one small mistake does not become a serious emergency. So thanks so much for being here with me today. I hope this episode helps you create a medication routine that feels safer and easier to manage. For more practical tips and caregiver resources, visit us at seniorsafetyadvice.com. You can also find Aging in Place professionals through our sister website at aginginplacedirectoryhub.com. Please subscribe to the podcast or to our YouTube channel so you don't miss future episodes. Until next time, this is Robin wishing you safety, confidence, and peace of mind. Thanks for listening. Take care. Bye.